what I try to remind people here is that never before in the history of mankind has every single government, every single country stopped for one purpose, and that's to deal with this one disease. All pharmaceutical companies, all universities, all researchers stopped everything they were doing and poured all their resources into the development of this one vaccine. But more than that, this vaccine wasn't necessarily made from scratch. We need to understand that SARS-CoV-2 is part of a much larger family of coronaviruses, and we have known about the much larger family for many, many years. So we had general knowledge and had to get down to understanding this specific type of coronavirus. The mRNA technology used for the vaccine has also been in development for many, many years. No, the vaccine will not give you coronavirus because unlike some of the other vaccines that we use, it doesn't have any live or dead part of the coronavirus in it. The phase 3 clinical trials that were done showed that there are very mild side effects that people typically get. I got the vaccine myself, and all I got was arm tenderness a couple of hours after I had it, and it lasted about 6 to 8 hours after both shots. Now, other side effects have been reported, and those include fever, headache, muscle ache, fatigue, most commonly seen after people got the second vaccine. And what I like to remind people, though, is that in all those cases, those side effects did not last more than 2 to 3 days. I have had friends who had some of those side effects and a very few who had all of them. And they said, again, didn't last more than 2 to 3 days. And the most important question I always ask them is, would you do it again, even with those side effects? And they say, without a doubt. So what's really in the shot is the mRNA genetic code, which basically tells the body how to build a protein that will then trigger your immune system to make antibodies that can fight coronavirus. Once the code has made that protein, it absolutely disintegrates and there's none left in your body. So at no time are you being given actual coronavirus. What else is in there are what we call buffer ingredients that help to carry that in. These are harmless water, sugars, etc., that have all been tried and true. If you are getting either the Pfizer, Moderna, or in the future, if other 2-dose vaccines are approved, then yes, you do need to get 2 doses because the 95% efficacy that we see in both Pfizer and Moderna was only proven when people got both shots. There is absolutely no nanochip in the vaccine. What I like to remind people is that although there's a lot of concern about how these vaccines are made, and let me be very clear, for good reasons, especially in communities like mine and Black and brown communities, we know that there's been a really, really horrible, bad history of atrocities that were done in the name of science on Black and brown bodies, going all the way back to slavery, including historic incidents like Henrietta Lacks, like the Tuskegee experiment. And so I have every single understanding and empathy for people who are not sure that something bad has been done in the development of these vaccines against our communities. What I really have enjoyed about being an infectious diseases doctor during this time is that I have access to the data, have reviewed it myself. I know some of the people who have been involved in the leadership of this in either the Pfizer, Moderna, in the external review boards. That means the bodies of people that were put together that were external from the actual trials to look at the data independently and say if it was sound data. As well as Dr. Kazmika Corbett, who I've had the pleasure of actually being on a panel with, who again developed this vaccine. And so we have had our own input in this, and there is no way that something like a nanochip or any serious side effect would have ever been allowed to go through. And this is the same process that we do for the vaccines that currently all of us take, mostly without question, that have caused no major issues in our population. So again, no nanochip in this vaccine. The answer is yes. The reason for this is that the trial was not designed to be able to say if people who don't have symptoms of coronavirus will still get coronavirus after getting the vaccine. So it was not designed to be able to say if the vaccine prevents asymptomatic spread. What it did show was that it was 95% effective in preventing people from getting coronavirus. And it also showed that in the few people who did get coronavirus, their symptoms were more likely to be mild compared to those that did not take the vaccine. So there's two reasons really to take the vaccine. It's likely to prevent you from getting coronavirus, but even if you do get coronavirus, which there's a much smaller chance of, you are more likely to have a milder version, which I think is a best case scenario. That's just something we do not know yet. We are still following the data from the initial trials that allowed us to have this vaccine, and we're continuing to do more research to see how this goes. This could be anywhere from a one-time vaccine or as often as a yearly booster like we do with flu, or somewhere in between. Time will tell. However, we still know that this vaccine is the most important tool in our toolbox right now, which still includes masking, social distancing, hand washing, until we get to herd immunity, until we get to the point where most people in society, at least 70%, have immunity against this, because then even the folks who do not have immunity are well protected. We just don't know yet. We do not have enough data to be able to tell if this vaccine will be a one-shot vaccine or if it will be the type of vaccine that we need to take a booster every year like the flu shot. Again, that will depend on whether or not we reach herd immunity, and when we do, seeing how long people can have lasting immunity.